name is Natalia Luxardo. I'm a social scientist from Buenos Aires, Argentina. And in this 15 minutes video, I'm going to share some reflections and challenges faced during a 5-year collaborative research in peri-urban areas of Entre Rios, that is a province of Argentina. And the research goal was to explain the role played by the first level and other social determinants of health in the continuum of cancer control in structural vulnerable communities. I will also share some audiovisual registries that Marcel Kolbenbach, one of the researchers, has been preparing. Well, we have 4 theoretical pillars in critical medical anthropology, social epidemiology, and Latin America social medicine, along with action research. We'll start now with some of the ethical dilemmas that implies taking a not restrictive version of ethics. That is, that instead of doing a reflection on abstract concepts, I'd like to share some concrete problems that have to do with day-to-day research activities. I will discuss these challenges considering theoretical frameworks such as vulnerable community models of ethics, and others that have to do with action research and the model of ethics of responsibility, and feminist models of ethics of care. As regards the first one, underserved and vulnerable communities models of ethics, well, we include health centers in historically disadvantaged neighborhoods. As you could see in the videos, many people in this community earn their living in an open pit garbage dump.
¿Cómo no? Che, ¿qué están seleccionando? La señora de diamante, ¿qué selecciona?
¿Yo?
Sí.
¿Qué junto?
Sí.
Cobre, aluminio, bronce.
Ajá. ¿Y los plásticos que tirás?
Para el dueño de la basura.
Plástico por un lado, cartón por el otro lado, revista por el otro lado. Y comida. Y la comida se junta.
O sea, eso es...
Este es para los caballos, para los chanchos. Fiambre, pan. Fiambre.
Eso se puede recocinar.
Eso se puede comer. Pero hay días que no sale nada.
Hay días que no sale nada.
De comida, nada.
And the communities has also high rates of early death by firearms, high rates of consumptions, etc. So, in the first ethnographic cycle, when immersed in day-to-day social works, the first dilemma was how to reconcile the urgent short-term needs and also the interest with long-term research goals that have to do with cancer, which was the less interesting topic for them. So, do we have to change the goals? But could we start with a new topic? For example, youth consumptions and ecological issues, unemployment, etc., etc. How could we do a good research when with a completely new area of inquiry? Also, as originally a social worker, during open interviews, I could identify that some demands and some needs have institutional resources available, so I have the dilemma of how to continue, either as a researcher or as a social worker. So the first decision had to do with recalculating, being a flexible design, allow us to do changes in the first ethnographic cycle that have to do with the local emergence, interest, the actors, local stakeholders, and redefinitions and alliances. So I will provide some tips for further thinking vulnerability. You will have the complete references at the end of the PowerPoint. Researchers are a potential source of harm that can increase vulnerabilities once the research begins and long after the research ends. The identification of local stakeholders and professionals that will continue there from another position, not only as researchers, is very important in order to facilitate concrete interventions and resources. It is needed not only individual informed consent, but also communitarian informed consent. The consideration of the history of the participants and their context, culture, is especially important as regards the historical distrust between researchers and the people. So vulnerability issues led us to engage with another epistemologies that enable us to provide or to think how to deal with these short-term demands, but also to continue with the pursuit of the long-term goals related with cancer inequalities. This needs a coherent articulation of tools, protocol, designs, and involvement of some participants as active co-researchers in a realistic and honest way. For doing so, we include a social organization, la Casa de Asistencia y Acompañamiento Comunitario, or CAC, as the platform, as the basis to do the recruitment, the deliberations, and the decision making of the research. Also, we include local professionals such as nurses and social workers that will continue in such context. We have to consider that vulnerabilities have not only to do with poverty, but it's discrimination by society, but have to do with the ways these groups are depicted in the media, and it's having to do with living in the worst places, with the worst access to public services such as education, health, justice, etc. These are continuous, subtle, and direct forms of violence against their dignity, rights, that needs to be carefully addressed. It is also a research responsibility to ameliorate in the short term the impact of such structural and cultural forces, providing spaces and inclusive projects to be part of during the research process. This is a tiny part to consider relevant to include within an ethic of responsibility, and this is completely different of disposable inquiry. So, ethical tips for further thinking collaborations: who claims to know and how, what power relationships is produced by these, consider strategies to compensate the disparity in the power dynamics that exist between researchers and participants. It needs close relationships with participants and stakeholders, so it's important to invite them to see the development of the process. Collaborations need to be defined in all parts of the process: research questions, methodology, design, analysis, but also disseminations of findings, ownership. Consent requires an ongoing process of discussion, reflection, and renegotiation. So this have to do with epistemological reciprocities. And the last one, the feminist models and ethics of care. In January 2020 was the last fieldwork. Coronavirus lockdown since March here in Argentina. So what about commitments to stay close after getting so personal, intimate lives during these 4 or 5 years? Also, the pandemic and social circumstances shed light on the asymmetries and power imbalance among parts. Is it ethical to continue as planned when the forms has changed so drastically? For example, I can't get no more personal interviews, but cell phones, video calls, on WhatsApp encounters with people. But the research process has to get to a partial end for being able to continue with new ones. So final products accomplished need to be ready to share. After group virtual deliberation, we decided to continue even under these different circumstances with active involvement of some of them. So being reflexive, honest, it's very important. Ethical tips for further thinking care. Avoid that participants feel further disempowered by any of the phases and activities of the research process. Not involve participants only for data collection. Consider that privacy and confidentiality are different. And finally, discussions linking ethics, epistemologies, methodologies needs to be explicitly addressed also in social science. And this is not only at the beginning or during the design phases, but it should be addressed during the whole process and even after the research has ended. This means getting into a slower process that is maybe it's less known. For positivistic inquiry is much more problematic, is accused of being only politics, and colleagues can be less interested because many times it means less publishing, etc. But building long-standing relationships when working and studying in vulnerable communities that are already over-researched and with continually broken bonds with researchers that come, take some data and disappeared forever, or that writes about them without even having visited the places, should be avoided. Local organizations are important to be included as also local stakeholders who are the one that can provide some resources to deal with short-term needs. And this can't be done quickly. Well, thank you so much.